Subscribe to ABN Media Network and become part of our family and learn so many new things.
Why are most babies born through C-section? In Europe, the first ultrasound is usually done after 4 months, and if the parents wish to know, the baby's gender is revealed. During delivery, the husband stays with his wife, and only 1 or 2 nurses are present in the room. No medicines are given. The woman screams in pain, but the nurse calmly tells her to be patient. About 99% of deliveries are normal. No injections or medications are given before or after delivery. The woman feels encouraged because her husband is right beside her, holding her hand. After birth, the husband cuts the umbilical cord himself, and the newborn is placed directly on the mother's bare skin to help maintain body temperature. The baby is only fed the mother's milk, and neither the mother nor the child is given any medicine except for one protective vaccine given immediately after birth. Everything from the first day of pregnancy to delivery is free, and after birth, parents start receiving financial support for child care. In Pakistan, when a lady doctor comes for delivery, she often asks the family beforehand, is this her first pregnancy? The case looks complicated, her life may be in danger. We'll have to perform a C-section. About 99% of the time, doctors try to turn a normal delivery into a surgical one. Before and after delivery, medicines are given by the kilogram. During delivery, even the woman's mother or sister is not allowed inside, let alone her husband. Only God or the woman herself knows what happens inside. A normal delivery costs around 20,000–30,000 rupees, while a C-section costs 80,000–90,000. Why would a doctor prefer a normal one? They also have expenses, children to send to good schools, new cars to buy, bigger houses to build. As for what Islam says, what humanity means, or what truth is, none of that matters. All that matters is money. Full score. These so-called healers, whom people consider saviors, have in fact become butchers. If anyone doubts this, spend some time among them and you'll see for yourself. Like many other sectors, healthcare in Pakistan has become one of the biggest mafias, where there's no real bond left between a patient and humanity, religion, or ethics.